My apologies, there you go. It's what a great way to start. Good evening and welcome to the People ONS meeting on the 25th of July 2024. It's now 7 p.m. and I would like to start this meeting. I would like to remind everyone present that this meeting is being live streamed and recorded for publication on the Council's website. The first item on the agenda is apologies for absence. Are there any apologies, Councillor Manwell?
Linda, can you use your microphone? Councillor Linda Heath has sent her apology. She's on the way but stuck in traffic, so she'll be here at some point.
I do know that Councillor Jones is in the building. I was speaking to him a moment ago, so I'm hoping that he will appear as if by magic very shortly. Any other apologies to the clerk?
We've had apologies from Nicola Cranch and Kim James. Also, Janet Simon and Michelle Lucas aren't joining us today either. Thank you.
Okay, thank you very much. Are there any officers who were invited or representatives of outside organisations that we were expecting that have not attended?
No, none.
Thank you. Councillor Jones has now arrived. Items of urgent business. Has anybody got an item of urgent business? I haven't received any, although I'm going to bring one very shortly, unless anybody else has got anything to come to the meeting. No. Okay. Earlier this month, I attended a meeting which was a briefing and discussion about neonatal care in Mid and South Essex and the options that need to be debated ahead of proposed changes that are going to happen. We have 3 very good centres across the region, but change is going to need to happen because there's an amount of capital investment that needs to be made that the money really isn't there. So things are going to have to change. That will no doubt be brought to this committee at some point in the near future. But one of the things that was mentioned during that meeting that I found of great concern, and I have briefed members of the committee of my thoughts, is that there is a significant disparity between the 3 regions of the Mid and South Essex NHS Hospitals Trust in relation to appointments for children who are referred by GPs. And in fact, the disparity is such that the waiting time in Broomfield, which is Chelmsford area, is 30 weeks, which is quite awful. In Southend, it's 43 weeks, which is pretty awful. And in Thurrock, I'm astonished to say that it is 60 weeks, which I find totally and utterly unacceptable. So there are going to be some questions asked on this matter, and we will be bringing it, or I hope to bring it back to this committee. As I say, I did sort of brief anyone who's here this evening about this, and there are some information that's gone out. I don't know whether anybody would wish to comment at this stage, or then we'll move on to the scheduled business if not. Councillor Hooper.
Thank you, Chair. I have started to ask questions about this. The Trust are aware that the figures do not look good at all, and they are implementing a plan where they hope to get the waiting time down to 25 weeks by March. This is something we'll be closely monitoring and trying to work with the Trust to meet that target, if not better.
Thank you, Councillor Hooper. So we'll now move on to item 3, which is minutes. And I will move that the minutes of the previous meetings as outlined in the agenda are approved as a correct record. Those 2 meetings are the Health and Wellbeing Overview and Scrutiny meeting held on the 7th of March 2024 and the Children's Overview and Scrutiny meeting which was held on the 12th of March. I've just got a couple of questions on those meetings minutes. For example, on the 7th of March, on the meeting that I attended, there is a list of councillors who were there. There were 1, 2, 3, 4 of us and the lay members of this committee as well. there is, other than Mr. Wake, who is here with us this evening, there is no list of the other people who attended or who actually spoke. And I think that in terms of the minutes of a meeting, that information should really be kept there. We need to know who is attending our meetings and if and when and what they say when they're there. There are actually some comments in the minutes themselves, but I think it should be, that's a personal view, on the bit in attendance, and I will address that with the clerk. So those that were present at that meeting, which is, as I say, literally myself and Councillor Hooper, who was then the chair. Now, I'm not sure whether the protocol is such that he can say whether the meetings are okay or not, because is that, because it would have to be members of this committee, wouldn't it? Or is it people who were present at the actual meeting itself? At the meeting. So, Councillor Hooper and myself, are we agreed that?
Agreed.
And the same situation arises for the minutes for the 12th of March, in that I believe the actual only person who is in this room this evening who was at that meeting is Councillor Hartstein. So,
Councillor Rigby, you came.
oh, sorry, Councillor Rigby, I do apologise. You are there, and I'd ringed earlier on, so my apologies. So, would either of you be prepared to confirm that they are?
I was there in my role as the portfolio holder. I did make a report. He's done there, though.
Well, again, I sort of come back to what I just said about the previous set of minutes. I think it's really important that when we take minutes of meetings, that we record those who were in attendance, and we certainly record those who spoke. So I hope that, that those oversights on those two sets of minutes are corrected, and as and when they are given the... Sorry.
On the minutes of the 7th of March, I was actually in attendance, but I was virtual attendance. That's not correct. That's not recorded.
Thank you, Councillor Fish. I would like that to be added to the list of things to be put right. As and when, if people are happy, I will meet with the administrative staff afterwards and sign those minutes on your behalf, assuming all those amendments are made, if everyone is okay with that. Thank you very much indeed. We now come to item 4, declarations of interest.
Five.
4. Anyway, well, whatever the number is on the different sheets, we've obviously got different. There it is. One's in front of me, and it's different to your own. Anyway, declarations of interest. Does anyone have any declarations of interest to make to this meeting? I will just make the point that since the annual meeting of the council, I was nominated by the authority to sit on the board of EPUT. There's very little that would touch on EPUT this evening, but it is my intention now as a board member that should EPUT come up in our future meetings, I will defer to the deputy chair or whoever is acting in that role while those matters about EPUT will be discussed. I think it would be inappropriate for me to chair a meeting as a board member to discuss EPUT, but it doesn't really affect this evening. So we now move on to the next item, which is the review of the Overview and Scrutiny Committee responsibility and the Thurrock Scrutiny Protocol, which were agreed by full council in March 24. We have the opportunity to ask questions or note them, and what I should say is I'd like to thank all those members. We had a training session on scrutiny, which was very well attended, and indeed it was more than very well attended. It was extremely well attended, and I found it a very interesting meeting to sit in and to discuss about how we're going to operate scrutiny. So those that did attend, thank you very much indeed. So do any members have any questions on those documents that they were sent in advance? Councillor Johnson.
Thank you, Chair. Yeah, it's item G. I think I might know the answer, but it's just not particularly clear. It says there shall be no power to appoint substitutes to any overview and scrutiny committee. Is that saying that we can't sit here and say, I want to substitute someone in for me? Because we do have substitutes. Or does it mean we can't pick a substitute outside of the substitutes that have already been agreed? What does that exactly mean?
Can I take some advice from our officers on that?
Thank you, Chair. So, yeah, the substitutes, I think, were originally decided that we wouldn't have them, but I believe that was discussed at the full council meeting. So we do have a list of nominated substitutes for those that aren't able to attend. So just for noting.
Okay, well, we will note that, but we will definitely, I think, need to inform all councillors if there's... Councillor Johnson's very astute. He reads things and looks into things, and if he's concerned and sees something that hasn't been done, then I think we need to make sure that we do rectify that and that everybody is aware of the situation. I mean, there has been a lot of change, so it's probably understandable that some things will slip through the net. It's not a criticism of anybody, but where they are spotted, they do need to be corrected. At which point, are we all agreed that those items are noted? Okay, we now move on to one of the more substantive parts of this evening's meeting, which is the discussion on children's healthy weight management and the setting up of a task and finish group. Sharon Stoltz is going to present the report to the meeting. Sharon, could I also just, for members of the public who are watching this and new councillors, could you just explain, you're the new Director of Public Health. I think this is your first official meeting. We had an informal. If you could just explain your role, which will help put what you've got to say in context.
Okay, thank you, Chair. So, yes, my name is Sharon Stoltz. I started in Thurrock as the Director of Public Health towards the end of May, so been here for a little while now. But I am an experienced Director of Public Health, having been in that role in other authorities prior to coming to Thurrock. Essentially, the Director of Public Health's role is about work to improve the health of the residents of York, and to look at where we have variation in healthy life expectancy.
We're not in York, Sharon.
Yeah. So, so as part of that kind of overarching role, looking at the health of residents of all ages, one of those areas is childhood obesity, which is the topic of the agenda item this evening. So the previous Scrutiny Committee received a very detailed report on childhood obesity at your 12th of March meeting. And there's details of that discussion on pages 15, 16 and 17 in your reports pack for this evening. So I'm not proposing to go back over any of the information that was discussed last time, although obviously I'll be very happy to take any questions on that. The purpose of this item coming to members this evening is really to agree the proposals for the Childhood Obesity Task and Finish Group. And the details of those proposals are set out in the appendices. So the first appendix is on page 47 in your reports pack, which sets out the proposed scoping and outcomes for a task group. So the proposal is there together with an overview of an outline timetable and some of the tasks that the Task and Finish group may want to focus on. If I can then draw your attention to Appendix B, which is on page 51 in your reports pack. This is the proposed terms of reference for the Task and Finish group. So the proposed purpose of the Task and Finish group is to gain a better understanding of the issues that impact on children being able to achieve and sustain a healthy weight in Thurrock, and then to look at some of the work being undertaken to tackle that. The proposed outcome then of the Task and Finish group will be to provide a report on the summary themes, so the findings from the task group and any particular themes that the group wants to identify, that will then form a report with recommendations that will come back to this committee. The proposal then would be that whatever actions, whatever recommendations come from this committee would then be reported back to the Health and Wellbeing Board, but they would also be used to inform the refresh of the whole system obesity strategy. So the proposal is that work starts in September, which is when schools and colleges will be back. And then on page 52 in your pack, there's a table there which sets out a range of proposed activities that could be fitted within the timescale allotted to the Task and Finish group, which is 10 weeks. So the recommendation then, Chair, for the committee is that the committee reviews the proposals, both for the Task and Finish group, the scoping outcomes, the terms of reference, that those are agreed by the committee this evening, and that the committee then seeks to appoint a chair of the Task and Finish group, and then seeks nominations of which members will sit on the committee, and I'm sure the scrutiny officer will correct me if I'm wrong, but I think the proposal is to have between 4 and 7 members on the actual committee. So that's the overview of the report, Chair. Thank you.
Thank you very much. I think there's probably a little bit of detail in the documentation that was before us that hopefully everybody has gone through. But I think just for people who are sort of looking at this meeting from outside, assuming there is somebody on the end of the cameras, this is a significant problem in Thurrock, and some of the latest data that we've got shows, for example, this is just to put in context of why we're doing this, is that 23.9%, that's almost 1 in 4 of 4-year-olds at reception classes across Thurrock are overweight or obese, which is significantly higher than the rate for the rest of England by several percent. And in Thurrock, when you get to around Year 6 children, that has risen to quite a staggering 38.7%, which again is significantly higher than the rates for England. And these figures have been on a consistent rise over a number of years now. And I think there really is a need for this council to take responsibility to try and lead the way. At the end of the day, this is all going to be down to schools and parents getting messages across, and all we can do is help get that message across there. We cannot physically solve this ourselves, so I'm pretty certain this is going to be an information-led Task and Finish group, but it has got some really achievable aims within the timescale that we've got. So that just sets the scene. I hope, and I'm sure there are some questions for Sharon from members. So if anybody would like to ask a question or speak. Councillor Cecil.
Good evening, good evening. On page 52, Sharon, top of the page, activities. The third bullet point, meet with the children and young people to get their views. Fine with that, but I would also like to understand why we're not getting the views of their parents and carers at the same time.
You're absolutely right, and what we recognise, in fact, we had a conversation at the children's DMT earlier this afternoon, and recognised that children neither buy nor cook the food that they're provided with. So in this context, it would be very much about meeting with those parents and carers as well. So so children don't access the weight management services in isolation. They are coming with their parents and carers. So my apologies, Councillor, that this wasn't explicit, but absolutely it would be a given that we would want to be seeking the views of parents and carers as well, and understanding some of the difficulties that they may be experiencing in being able to provide healthy food for their children. It's important that we understand that so that we can seek to find appropriate solutions that will support them.
Thank you very much. Thank you.
Councillor Arnold.
Thank you, Chair. This is quite a historical problem. This isn't the first time that we've come across it. Yes, absolutely, we need a task group. We need to be doing something about this. But I see a lack of historical data for Thurrock. So I see we're going to be comparing with other councils, which is great because you need those ideas. But what happened with previous initiatives? Did they work? Didn't they work? Has it got worse? Has it improved, but it hasn't improved enough? I'm left with a lot of questions that I feel I need a more in-depth report for of at the end of the day, I don't want us to come up with a set of initiatives that have already been done and didn't work. We obviously need to do something differently. So what are we going to be doing differently? And I'd like to understand the whole picture better.
Those points are very well made, and I echo them. Sharon, would you like to comment?
Yes, of course. I mean, I think it's important to understand that this isn't just a problem in Thurrock. It's a national problem, in fact, a worldwide problem in the developed world. Certainly, we have got historical data. So the National Child Measurement Programme that measures children in reception and Year 6 has been running for quite some years now, so we do have that historical data for Thurrock. We haven't had previously any targeted weight management services for children and families previously. There's obviously been the work that our Healthy Families programmes, so our health visitors and school nurses have been doing, but we haven't historically invested in targeted weight management programmes. So we can certainly provide historical data. I can certainly talk about and can certainly provide the task group with some information about the efforts that have taken place previously in Thurrock. But the programmes that we've introduced now are the Henry programme that is aimed at preschool children, so that's children 0 to 4 years old, that is now being rolled out through the family hubs. And then it was only last year that the public health team commissioned the targeted weight management programme for older children. And so you're absolutely right, Councillor, that we need to understand what works. I think this is an ideal time for the task group to start to look into some of those services that we've put in place, to learn a little bit more about those services, talking to the people running the services, parents, carers, children themselves. And then we'll need to evaluate those programmes to find out whether they're actually achieving the outcomes that we want. So this is very much, I suppose, a future-looking programme, as opposed to a looking-back programme, if that makes sense.
Councillor Arnold.
It does make sense, but there's still that thing of if what we're doing now is going to work, and what happened before that did or didn't work. I might have misunderstood or misheard. I thought you said there's a programme already being rolled out called Henry. Isn't that a bit horse before the cart? Why are we setting up a task force to look at what we need to do, and if we're already rolling out a programme?
I don't think the task group is necessarily there to tell us what we need to do. I think it's more about the task group really looking at what we already have in place. So, looking at that historical data, Councillor Arnold, you're absolutely right. So the task group having access to all of that information, having the information about the support that's currently available across Thurrock for families, being able then to dive into some of that and ask some questions. Members will be able to go in, you'll be able to observe, you'll be able to ask questions about those services. And also, I'm sure, from all of the listening that members will be able to do through the Task and Finish group, come up with some really valuable insights that as officers we may not have, but also I think crucially look at where there may be gaps as well. So the Task and Finish group may well identify some things that we haven't considered. I may also be able to identify where we've got some gaps in services as well, that will then help to inform our future commissioning plans and our future service development plans as well.
Councillor Arnold.
Thank you, Chair. Thank you. That's much clearer now. I can see the picture in my mind. Thank you.
I think Councillor Mann was going to speak in a minute, but if I may just throw in my 5 penn'orth here. I think we talked at our informal meeting a few weeks ago when this committee first came together about what we could achieve in the forthcoming year, because we know the council is going to change possibly radically in May next year, and we don't want to become stagnated in that period of time by saying, there's no point in doing anything now because things are going to change, blah, 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 blah. So we specifically looked at things that this committee could work on that would have outcomes within a period of time. And I think it's more than just getting insight. I'll be honest with you. I don't particularly think we need to get insight. I think what we need to do is get an action plan put together that hopefully we will be able to say that we have made a difference come May next year, and we've started an improvement on what is a very poor situation for Thurrock. So I think we do need to do more, and I think this task group needs to recognise, and I am absolutely certain from whoever is on it, from those people that are here this evening, that they will do that. And I know there are going to be some very impassioned people on that committee who are not going to sit about and go through all of the things that have gone on before. I think my role as chairman of this group is to listen to what people say, and I compliment Councillor Arnold for picking up on something that I hadn't really given a great deal of thought to coming into this evening, and she's absolutely spot on. This reference to historic data is really, really, really important. In effect, what we can do is we can do a RAG report on what worked and what didn't work, because as Councillor Arnold very astutely says, there is no point in reinventing the wheel to failure. We really can say, okay, we tried that. It's worth thinking the fact that parents are really influential in this, So let's talk about the young children that we're talking about. I'm making a very sweeping statement. Their parents are going to be the 30-year-olds of today, who've come through Thurrock, who've gone through all this time, and they've now got children of their own. So I would like to propose that when the task group committee first meets, it has provided by the officer cohort, and this is going to take some work and time and effort and research, but it gets a proper timeline of all the initiatives that have taken place going back, and I've just picked a date of 1994 for two reasons. A, it's a round number, and B, it was just before this authority became a unitary authority and took on the powers that it's got. So it's going to be relevant and easily researchable because it is part of this council, not councils that went on before. So I would like, and it's down to members of the task force when they agree, if they would like to reinforce that view, but I would challenge the officers now to actually come forward with a document that is a timeline, that is detailed, and is honest and says, well, we tried this and we thought it was a great idea and it didn't work, or we tried this and it was starting to work and then for some reason it went wrong. So we can analyse data and we can analyse facts. I hope that meets what you were trying to say, Councillor Arnold. Thank you. Okay, so I think we'll discuss things when we round up. Yeah, Councillor Fish, Councillor Manwar is next.
Councillor Fish had his hand up before me. So.
I do apologise. Councillor Fish.
Thanks, Chair. I was just thinking, in that scope of the task and finish group, if we were to come up with findings that what's been done in the past hasn't worked, what would work is something that's maybe more bespoke and one-to-one, but it's more expensive. Will it just run into the sand because it's more expensive?
Sharon.
So we the weight management programs, the Henry program for the preschool children, and then the weight management programs aimed at children and families, are based on what we think is the best evidence available of what will work. But those programs need to run for a sufficient period of time before we'll know if they work. So the Henry program, for example, that we're rolling out through the family hubs at the moment, has been running for a number of years now in different parts of the country. And there is a good evidence base for that, but we've only recently introduced it to Thurrock, is my understanding. And so that needs to be introduced, it needs to be embedded into the family hubs, and needs to be running for probably at least a year, if not 2 years, before we're going to have any hard data and tangible outcomes as to whether that has actually worked. So we measure children in Thurrock in reception year when they start school, and then again in year 6. So because children's obesity is such a complex issue, we will need to have these programs running for quite a while. And then we won't really know whether it's had an impact, a significant impact in Thurrock, until we see the National Child Measurement data starting to change. So we'll have information on the weight of the children that have been through the programme, but what we really want as part of our whole system obesity approach is to look at it across Thurrock, at a child population level across Thurrock. And it takes time to be able to build that really rich picture of whether a programme is working or not. So we need to give it sufficient time. If we wanted to do some really intensive one-to-one work with families, as you're suggesting, that would require costing, obviously, and because these programs are funded out of the public health grant, and that is a finite budget that has to fund all of the public health services across Thurrock. Members would have to have myself and the public health team providing you with enough information that you were able to make a decision about whether you wanted to put further investment into something like childhood obesity, but in order to fund that, you might need to disinvest in something else because it's a finite budget. It's a ring-fence grant that all local authorities get from central government. So I don't know if that answers your question, but it's very difficult to be able to measure issues like this over the short term. We're going to need to have these services running for a sufficient length of time before we're really going to know whether they work or not.
Councillor Fisher.
Yeah, it's a really interesting reply because then it begs the question of what does success look like? Because, I mean, I'm sure you can encourage children to lose weight in a short period of time, but is that going to last? So, I mean, how long are we going to actually be keeping these, keeping these checks on for? It could be years, in fact, couldn't it? Should be years.
It's a very good question, and it is one that we need to do some further work with, because there are a couple of things here, aren't there? There's the measures of success that we as a council might want in terms of value for money, for example. But then there's also the outcomes that the children and their families might want. So, and that might not necessarily be weight loss. You don't necessarily want children to be losing weight, for example. You want them to grow into their weight. So, so the measures of success, you're absolutely right, Councillor Fish. It's an excellent question, and one that I need to go and do some further work on, because I am really committed to those measures of success being meaningful for those children and families, and their measures of success might be different to the ones that I might want or you might want, for example. So a really good question, and one that requires further work.
Councillor Fish. I will get to Councillor Manware in a minute. I just would again, sort of listening to the two comments that were made, or the series of comments that went between Councillor Fish and Sharon. I'd actually written down here a few minutes ago budget, and with a big question mark next to it. And I don't know whether it would be inopportune to ask Councillor Hartstein if, as we're talking about budgets over a wider range affecting children, whether any of this has crossed your desk, or whether you're aware of, for example, was it Henry that's going on? Because clearly that should be on the portfolio holder's desk, I would have thought.
It's Councillor Hooper's portfolio, because this is public health sits with Councillor Hooper, and this is funded out of public health grant. But you're right, Councillor Spate. It's one of those issues that actually cross-cuts children's and the health portfolio. I'm very happy to meet with Councillor Hartstein and brief you on this, including the budget that is available. So very happy to do that outside of this meeting.
Yeah, please speak.
Yeah, thank you. Yes, I knew about the Henry programme anyway from the previous time sitting on the Children's Overview and Scrutiny, but absolutely, yep, thank you. I would like to meet, that'd be great. Thank you.
And at that point, Councillor Hooper, is that, do you minded to say anything, or are you happy to?
It hasn't really come across my desk as yet, However, what I would say is I think it's an important part of our strategy. Our strategy is to invest in stopping long-term, more expensive health issues within our community. No, though I'm not looking to write a blank cheque, here you go, off you go, I do think it's an important part that we invest some money in this area, because I do think it has long-term benefits for our whole community and our budgets in the long term. Does that make sense?
Yeah, Councillor Arnold, please feel.
So I'm very aware of Councillor Manuel, you've been incredibly patient. Yeah, it makes sense, but like Sharon says, it doesn't come out of to my knowledge, it doesn't come out of the general overall adult social care budget. It comes out of a ring-fenced government public health budget. So it's a little bit different how the pennies are managed. One thing, so I don't have to interrupt again, it's kind of already sort of, I don't want to say we're silo working, but one of the things that we've all been criticised for on both sides, councillors and officers, is for silo working. So it would be really good on things like this that there is some cross-service working with cabinet members and that when it falls into two different areas. You're absolutely right. The more heads and everybody understanding it is better.
Yeah, thank you, Councillor Arnold. And as I'm going to chair these meetings, I'm more than happy to get into discussions like we just have. And Sharon, what I would say is, I don't want you to think, oh, they're coming across negative or whatever, but we've been tasked to do a job now, and it was interesting earlier on, we had the CFGS briefing of what scrutiny should look like, and quite frankly, as I say, most of us in this room sat there and were told you've not been very good at scrutiny and you haven't asked enough questions and you haven't probed into enough corners. So we are going to raise these issues, and I apologise if some of them make you feel uncomfortable in a personal sense, but I'm not going to apologise for asking those questions. So we will move on, save the best for last perhaps, and it would be remiss of me not to compliment Councillor Manuel on her presentation to full council last night, which as many people have commented on how effective it was, and it's great to see an advocate for young people making an impact. So now I've put the spotlight on, start tap dancing.
Thank you, Chair, for those kind words. I've got two questions, actually. The first one is in reference to page 41, with figure 1, with the map showing the levels of childhood obesity. And I'm the councillor for Tilbury Riverside, or one of them, for Tilbury Riverside and Thurrock Park. And it really stands out to me that we have some of the highest rates of childhood obesity in the borough. And so I'm someone who was born and raised in Tilbury, and I can tell you there's at least like 5 or 6 different like chicken and chip shops or some sort of fast food, you know, what can I call it, provision, I don't know. But in terms of kind of managing kind of childhood obesity, like, I'm sure I have to state the obvious, like, you're going to go to what's accessible to you. So if you've got so much kind of cheap, readily available kind of fast food, as a young person, that's kind of what you're going to go to. And of course, there's that thing of it being kind of cheaper to, or at least in the short term, it seems, to go opt for that than healthy food. And so I know at the end of the day, we can't control what businesses set up shop where. And as a council, we have, you know, limited kind of scope in some of these issues. But what can we do to actually improve accessibility of healthy food? I understand as a task and finish group, as has been mentioned, this is more information-led, so we can't necessarily do certain things. But I just think it's important to kind of recognise the fact that if the material sort of condition of things kind of doesn't change, we can kind of do task and finishes and get information all we want, but nothing much is really going to change. So I'd be interested to know what, if anything, like, can be done to kind of address that. And my second question is in reference to page 49. So in terms of the meetings of children, which are going to be had, how are you going to decide who to actually meet with? And how is this meeting going to be conducted? Because I think we have to be careful that if it's not done in like a certain way, it might stigmatise certain groups, and like the way in which it's conducted is really important. I remember when I was in primary school, and I wasn't really aware of too much of it at the time, but I think these sorts of meetings were happening. But the way in which it was conducted was a bit yeah, I think it stigmatized like certain groups. So I don't know if you're even looking at like addressing schools or community groups or whatever, but it'd be really interesting to know how you're going to select who you're going to talk to and like what kind of sample are you going to take, and from that what kind of information can we get, because it'd be interesting to know if it's going to be just children who are kind of labelled as like obese or overweight, or are you going to talk to like all sorts of children and then kind of gauge from there. But those are my two questions.
Okay, both very good questions. So in relation to the first question, the council has signed up to a health in all policies approach. And part of that, there's a link to the health in all policies document in your papers for this evening. So the whole point of that is how we can take a whole council approach to addressing things like obesity, for example. And that includes, for example, the council looking at the opportunities it's got within its planning policy, within its regeneration work, the relationships that the council may be developing with businesses, to look at what controls the council is able to put in place to try and deal with a number of fast food outlets. So, for example, other local authorities have looked at revising their planning policy to reduce the number of fast food outlets within a certain radius of a school, for example. And they've also sought to limit the number of fast food outlets in a particular geographical area. Now, I don't know, I'm quite new to Thurrock still, so I don't know whether our planning policies as a council currently allow us to do that. But it is something that I think as a council and as members, you could actually be looking into some of those areas. And one of the, if you refer to the table on page 52, one of the suggested actions is for task group members to meet with officers in the council to discuss how that health in all policies approach to place shaping is being used. So having signed up to that approach, how is the council embracing that? Has it changed the behaviour of officers working in the planning department, for example? And how, and as elected members, are you sufficiently aware of the health in all policies approach? Is there some work that I could usually do with elected members, for example, to help members to understand that approach? And the opportunities that we have as a council in Thurrock to be able to address some of that. So really, really good question. And if I may, a challenge back to the members sitting around the table about, okay, so what are you going to do about that then with your own portfolios? The issue about talking to children, that work hasn't been done in detail yet, but I would be very much looking to Sheila and her team and Children's Services to use the opportunities that Children's Services have already got. So the Youth Council, there's lots of other work happening through the Family Hubs, through Schools Council. So there's a bit of that detail that's yet to work through, but we'll also want to be talking to those children and families that are actually accessing these services. So, the Henry programme is already running, so we'll be able to organise for task group members to go along and talk to the families that are participating in the Henry programme, and similarly with the Children's Weight Management programme as well. I take your point about not stigmatising, that's absolutely true. But at the same time, we know that certain ethnic groups and certain cultural groups have higher levels of childhood obesity. So we also need to understand why that is. And the only way we'll understand that is by going to engage with and talk to those communities. So you're absolutely right, we need to do that in a non-stigmatising way, but it is really important that we understand those cultural issues and challenges that particular communities within Thurrock might be experiencing. Because we need to make sure that the work that we're doing and the services that we've got in place are actually meeting the needs of those communities.
Any follow-up?
Yeah, no, I agree. Like, thank you. In terms of like the way the meetings are conducted, it's not so much in terms of like ethnicity or group. I mean, I agree with your point 100%. It was more so in a sense of like the manner in which the meetings are conducted, and like, yeah, it was more so from a, I guess you could say, logistical standpoint. But I 100% agree. At the end of the day, the work's being done for the benefit of these people. So we do have to look at cultural, ethnic, and if there's certain groups that are more affected, then they should be, you know, targeted. That's not a great word, but you know what I mean, like looked at. So yeah, thank you for your answers.
Well, we're queuing up for questions now, but we'll go Councillor Jones, Councillor Arnold, Councillor Rigby, Councillor Cecil. We will this item was supposed to go on till 8, but we've got a bit of time on our side, so I want to let this run. It's really, really important.
Thank you, Chair. Sharon, you've got a huge task in front of you. You really have. And coming to council as a newbie, like I feel I'm a newbie on this particular committee, but I'm an oldie because, like, going back years ago, I was a councillor, and as Councillor Arnold stated, I'm going back 10 years. I was a councillor before, and this was on the agenda then. So, you know, we can understand why we go over and say that we've been there before. So a couple of questions, really. You know, obviously we're going to all work to hopefully gain a good outcome. Can you just quickly explain the Henry programme? Where does it originate? And some of my question was answered, but where does it originate, and who chose this Henry programme as such? Was there other programmes, or, you know, how did we pick out Henry programme, and where does it, and what is its success rate? And number two, it might just help out, schools, do they keep the data on their children as being, should we say, health? Do they, you know, have a little bit of a data within the schools? Their children, as they, well, they've got health issues in this school or overweight, that they can pass on to council? Do you know? Thank you.
Okay, so you're testing me now on Henry. I haven't got the specific details of when and where it started. I can let Democratic Services have that information, Chair, so that it can be shared with elected members afterwards. But the Henry programme, so childhood obesity, you're absolutely right, has been a problem for probably longer than 10 years, probably almost as long as I've worked in public health. And over the years, various programmes have come and gone. But Henry is one of those programmes that has stood the test of time. And one of the reasons it stood the test of time is because it is known to be effective. And one of the reasons it's effective is because it isn't a programme, an external programme that is parachuted into an area. The Henry programme is very much predicated on training existing children's services staff. So in most areas, the programme is run by the health visiting service in partnership with Sure Start previously, then children's centres, now family hubs. And so the model that we're developing in Thurrock is very much based on the success of other areas. So, and one of the reasons it's so successful is Henry really starts from birth. So it's really grounded in prevention. It is about working with those parents and those families to be able to introduce healthy approaches to food from weaning onwards. And because it's very much embedded in mainstream services, health visiting is a universal service, so it isn't stigmatising particular people. It's actually embedded within our mainstream services. And I think the advantage we've got in Thurrock is that because it's the health visiting service working in an integrated way with our family hubs and with children's services, it's really going to be able to create that sustainable change, I think. And so what I would expect to see is, as we are measuring children in school through the National Child Measurement Programme, that over time we would actually start to see less and less children that we're measuring as overweight or obese. So the Henry programme's been around for quite some time, is used quite widely. I think maybe it might have started in Leeds many years ago, but that's kind of its background. But I can certainly get more detail around that. Schools don't collect data at the moment on the health of their children. I think I'm right in saying that, Sheila. So our reliable data around children's weight is through the National Child Measurement Programme. But one of the other pieces of work we do, which hasn't been done since before COVID, but this is something that actually we were discussing just today, is we're going to introduce the school survey. So the school survey will be looking at all of the schools in Thurrock who want to participate. So it's voluntary. It's up to schools whether they want to participate. But we'll be able to do that survey in partnership with schools, collecting data on a whole range of issues, and also children's attitudes towards things like food, emotional health and well-being, their sexual health, for example, smoking, vaping. Will be able to collect information on a wide range of children's health issues. So again, we'll be funding that out of the Public Health Grant. We'll be delivering it in partnership with Children's Services and with schools. We're hoping to be able to do the survey in the summer term next year. As you can imagine, there's quite a lot of planning involved in this, and we'll be starting the first conversations to get schools on board in September. We won't get all of that data back until probably next autumn, next year. But I'm sure the committee will be really interested in looking at some of the findings that will come back from that survey when we have that information. And then based on all of that data, that will help us to develop our plans then for how we're going to address those particular issues that might have arisen.
Thank you, Sharon. Councillor Arnold.
Thank you, Chair. You raised a really good point there around what restaurants, what takeaways etc. are available, and Sharon saying that some local authorities are looking to build that in with their planning. We've actually, like, we're just in the process, aren't we, with the local plan? We haven't set our local plan. And I just wondered whether we could maybe ask Councillor Hooper to work more closely with the Cabinet Member of Place to maybe join up some dots around these conversations. And is it, I don't know if it's possible, but could one of the places on the task force be for an officer or someone with knowledge from Place that could look at that and how we could tie it all together?
Thank you. Points well made. And I think when we've concluded the questions from other members, we're going to just have a brief talk about the structure of this committee. And I've certainly got something to say about how I think it should work. But
Thank you, Chair. Yes, I'll go on from something Councillor Arnold said and also Councillor Manuel about the fast food shops. The difficulty is that fast food shops do well and they're busy. So it's difficult with planning. I know it's been discussed before that is it better to have a fast food shop or an empty shop? It'd be lovely to have healthy shops, but whether or not they're going to be financially viable for a business, they'd have to be quite subsidised, whether that's something the council could look into, reduce business rates or something for a more healthy eating shop. But financially, I think it's a very tricky area because I know that we have discussed that before. I can't remember on what committee, but it is also discussed. Also, with regards to looking at different ethnic backgrounds, it's also a socio-economic issue, obesity, and it is lower socio-economic groups that are more at risk of developing obesity. So that would need to be something that we would need to look at as well, in helping the lower socio-economic groups educate in. And it is going to be a sensitive subject, also because statistically a lot of the parents of the overweight and obese children will be obese themselves. So it is going to have to be approached very sensitively, and obviously we're going to have to be very diplomatic in the way that it is approached to get the best out of people without putting people's backs up and at risk of offending people. That's going to be something that we're going to have to discuss on how best to approach that, I think. I think that's it. Thank you.
Again, points very well made, and you're absolutely right. I mean, a 6-shooter is not going to be enough to deal with all the bullets we've got to fire on this one. You're going to be going out with barrages of armoury and whatever. There's so many things to go and shoot at. It's going to be difficult to pin them down. But I'll be interested to hear later on, and maybe when we get this review that we're going to get of Henry and its successors and what it's done, we could actually get some instances where things like planning have played a part. I'm certainly aware of, in my career working, covering other councils, where there have been councils that have implemented this ban on fast food shops on planning terms. So it has been done. How successful it is, I don't know, but it certainly has been done in previous places. And we've got the historic data from Henry, which has been running for quite a while now. So I think we can learn from that. And then the task group is just literally going to go out and have to cherry pick the things that it thinks it can get an outcome on. And that's the point I'm going to keep coming back to. We can only tackle things, in my view, where we've a realistic plan of getting an outcome. And that outcome may simply be, it is the recommendation of this committee that the planning rules in the local plan change. That may be the only outcome we can do, but I think it will be a really good outcome. So at that point, Councillor Leakey.
I'm just wondering how, if we have thought about getting the consent of the children, if we're going to talk to them about this tax and finish group, how do we get a consent from children to talk to them about obesity? So are we going to get consent from parents? So I think that's one thing we're going to kind of consider if you're going to take on this challenge.
Yeah, so again, the public health team are not the experts at engaging with or talking with children and parents. It really is Sheila and her team. So this will be very much a joint programme of work across children's services and public health. And it will also very much involve the the family hubs that are already working with children and families, and we already have families that are participating in the Henry programme and some of the weight management services. So so we wouldn't be seeking to speak to younger children without parents or carers being there. For older children, again, I'll be very much advised by Sheila, but we have got forums already where we link with children, where all of those consent issues have been addressed. So we will be very much wanting to link into some of those existing opportunities we've got to talk with children. I think it is really important to hear the views of children and young people themselves. That is something that I'm committed to doing. It's no point in us commissioning services that young people, for example, are not going to find acceptable. So for older young people, it's an online programme. So again, we'd want to be seeking the views of young people that have engaged with that online programme to get their feedback from it. So that's absolutely key. I will be making sure that, through the expertise that children's services have got, that we do that properly and we do it really well.
Anything else, Councillor Leakey? Councillor Cecil.
Yes, Sharon, and perhaps Sheila. Can I have some clarification? Do I understand that at the moment our school children are weighed, at when they first start and at 6, and that's controlled by Sheila's team. So we get data from all our school children at 4, 4.5, 5, and so that data is on stream, and parents and children are used to seeing the year group ahead getting weighed whenever it is, so it becomes a normal part of school. Is that right?
Not quite. So the National Child Measurement Programme is a government programme, and it's one of the mandated areas that directors of public health have to make sure happens. So every local authority area has to participate in the National Child Measurement Programme. It's commissioned by the Director of Public Health in partnership with the Director of Children's Services, and it's actually delivered through the School Nursing Service. So the School Nursing Service will measure every child whose parent has given consent in reception year. So when they start school in reception year, age 4, 5, the School Nursing Service will weigh and measure those children. The weights are fed into a national database, because this is it's really about collecting it's so that we've got really good information about children's weight across the population, and then children are measured again in year 6. So in year 6 they're 10. So they're about age 10 in year 6. And that information is fed into, so I don't get the data for every child, neither does Sheila, neither does the school. It's anonymised data that is fed into the data collection system. And then what we get back from that is anonymised data. We can break it down by school, but it's not broken down by individual child. However, the School Nursing Service will let every parent know what their child's weight measurement is. So every parent will get a letter to say your child was measured as part of the National Child Measurement Programme, and they will be told whether their child is underweight, whether they're a healthy weight, or whether they're overweight. Now, in the past, picking up Councillor Arnold's point, Thurrock hasn't had a commission service to be able to respond to the fact that your child is overweight or very overweight. They've been able to access some advice from the school nursing service, but we haven't had a commissioned child weight management service. That was introduced last year, so it is relatively new. So that's kind of how it works. So it's only the school nurse and the parent who will know what their child's weight is. The school won't, I won't, Sheila won't. It's all confidential, and it's anonymised data. Is how that's actually collected. What the schools do get is a report that will tell them how many children in their school are a healthy weight or are very overweight. So it enables that school to be able to think about what policies they may have around vending machines, what other food policies they might have in schools. So that's how schools can use that information. But the actual weight is clinical information that is confidential to the school nurse and that parent.
See, I heard you say something about, birth weight, because children from birth are weighed, and they're not overweight, and they're not obese. They get weighed regularly, 3, 6, 9 months, and that is recorded. So you're saying we have no way of collating that data from 0 to 1 to when they're measured again at 4 and 5 in reception, and you can't even measure or relate. Well, you can do it by the school, you're saying, you can do it by the class, but not by the individual, unless you quietly talk to the nurse. So the nurse is the only one who has all this data. The nurse belongs to somebody, doesn't she?
So I think it's important to distinguish between a kind of clinical intervention. So if a child is measured either by the health visitor, the GP, or the school nurse, and that child is either underweight or overweight, the conversation will be about that individual child with their parent carer. And they'll be given advice on what they might need to do, some of the steps that they can take to be able to address that overweight issue. And if appropriate, with the parents' consent, that child can now be referred into the weight management service. So that is very much about what happens with that individual child or young person. The National Child Measurement Programme is different. It's about measuring all children across the whole of England in reception year and in year 6, which enables local directors of public health, but it also allows government to know what the weight status is of the whole child population across all of England. And so every local authority will be able to have access to the National Child Measurement data for their local area, which will allow us to do what we've done in the report. We can then map that against different postcodes. We can map it against different parts of the borough. It allows us to benchmark what our children's weight is against other areas. So it's two different things. National Child Measurement Programme is about all children in Thurrock, and it gives us a good understanding of that. The individual child or young person, that is very much a clinical issue, and it'll be managed by the health visitor, school nurse, GP, whoever it, or paediatrician, whoever it is that is actually managing the care of that particular child.
So we won't have any access. We won't have any access to any other data. So high dreams of digging in deep and
So the data we have
finding really
access
what's going
to
on.
is the data we have access to is the National Child Measurement data. So that's anonymised data. That's the data we have access to. We don't have access to the weight of individual children, no.
Thank you.
Thank you, Councillor Cecil. Councillor Hooper, time is progressing, and I will kick this on very quickly, but Councillor Hooper would like to make a point.
Thank you, Chair. I just want to pick up on a few things that have been said. So I'm agreeing to take away this, okay, in terms of my own actions as a portfolio to date, because there's been a really useful conversation, debate. As far as I'm concerned, this is really helpful to me. I will make it clear I will work closely with children's portfolio holder and place portfolio holders in terms of the data and information we get together in terms of future planning. Okay, I think I'm keen to find out what's worked well in other places. I'm keen to learn from the past. I think you raised a very good point, Councillor Arnold, earlier. And I'm really keen for the outcome of the working task finish group, which will help guide and hopefully support any actions in terms of going forward in the future. So I really value this task finish group. Okay, but I will feed back when I've had conversations with other portfolio holders when this comes back up on the agenda again. So thank you for your contributions. It's really been helpful.
Almost sounds like we've finished, but we're not yet, Councillor, and we've got to find the brave people who are going to take on this poison chalice. But before we do, and I've nodded in the direction of someone who I regard as a friend and also a treasured advisor, someone who is steeped in our local community, but probably even more important than all that is a food professional. And so I'll aim member Georgina, you've listened and heard what's going on here, and I would value your oversight on some of the conversations, and then that may shape some of those people who wish to step forward and join this task force.
Thank you, Neil, for the nomination there. So Neil is referring to myself as a business owner. I own an Afro-Caribbean shop here in Grays. And one of the questions I wanted to ask is, we've spoken about certain ethnicities being affected by obesity. Does the Henry programme look at their eating structures, their diets, things that they like to buy in terms of how that programme works? Because their eating habits are different.
I would hope so. The whole point about the Henry programme approach is to really work with families where they are. So it isn't a prescribed programme in that sense. So I would hope that they do, but I think it's a really good question, and it's something that the task group might want to explore a little bit further to find out to what extent it actually does that.
So I would definitely like to kind of be involved in that, coming from the expertise of, knowing what some of these ethnicities may kind of purchase and buy and what their eating habits are. So I look forward to working closely with you on that.
Okay, thank you, Georgina. Right, I think sort of coming to the nub of where we're at, I think it's really important. I want this task and fish to prove that this council is effective. So I want those people who are going to step up to the mark to know what help they're going to have. And I'm not sure who is best placed to answer this, but I just need some insight into the resources that if we go 4 or 5, maybe even 6 people from this committee to sit on this, and then we're going to expect an awful lot of them. And there's a huge amount of work to do in an incredibly short period of time. What is going to be the officer cohort commitment? How much resource are we going to be able to call on? I'm not necessarily specifically talking about budget, but I am talking about time. We're going to need quality officers giving quality time to this task force. Otherwise, it's just going to sit, and the best intentions of all those who come forward voluntarily to do more work is going to be wasted. We need to know from day one what we've got to work with. I don't know who would be best placed to summarise that, but I think it's a fair question.
Can I ask that Democratic Services do an initial response to that? I'm not sure how task and finish groups work in Thurrock, but I'm assuming Democratic Services will be able to give a bit of a steer. Clearly, the public health team will be involved and will support members. But if perhaps Claire could help with that response.
Thank you, Sharon. So there is just myself and Lucy as the other overview and scrutiny officer. So we will be split between the task and finish groups. So we will be facilitating, say, more of the formal meetings, but in terms of the behind the scenes activity, we'll definitely be guided by Public Health Children's Services. And I think I've also noticed that within the scoping document as well, there may be some activities that are held during the day. So I don't know whether that will determine which members are available for those particular activities and visits. We will obviously do everything we can to facilitate and sort of work behind the scenes with public health. But in terms of democratic officer time, there is very little input we can have sort of split between everyone. But obviously, yeah, we will do the very best we can to facilitate and do that background and desktop research as well with you.
Okay, well, that wasn't really the answer that I wanted to hear, but because I think we need to lay a marker down here about the new council and the way this new council operates. And you know, this is not, we're not going to have platitudes. We're not going to have committees and task and finish groups that sit in corners and do something that's not really supported and not work. And if it's expected that 4 of my councillor colleagues are going to give up more time to a cause which will be close to their hearts, they need the support. I mean, my view is on a small task and finish group like this, were I running a business and I had professionals and lay people that I'd call in to work in my business, I'd want to buddy up the people. There may be some people on the task force who have a particular interest. It may be going into schools, it may be looking at diet, it may be looking at statistics. And I need to know, as chair of this committee, that the directorates are going to make the officer time available. And I don't care how you do it, but I don't want any member of this task force to come to me and say, well, I asked for some help. I asked to go to a meeting, and I was told, well, it's not happening because the officers aren't going. We were due to go into a school and talk to some kids, but the officers aren't available, so it's not happening. I don't want to hear that, because if I hear that, I'll be going straight back to the commissioners and saying, you're telling us to change this council, but you've got to give us the bullets to change this council. So I'm going to ask now for any members or lay members who would like to sit on this task force to come forward and put their names into the hat. We can work out. We've got down here. It says my guideline is 3 elected members, 1 Conservative, 1 Labour, 1 Independent, and 1 co-opted member. Well, that can be a guide as long as we obviously we're not all going to sit on it. What I would say is to those that do come forward, if you need help, ask a buddy councillor on this committee. I spoke in our informal meeting about I want us all to be together. I tried to set up a WhatsApp group, wasn't very successful, probably because I'm a Luddite and can't work the technology. But I want members to say, you know, I'm part of this task group, but look, I need to get down. I should go to this school to a meeting. I can't do it. Could you sit in and just go and help me? And I'll make my time available, although I can't contribute at all in terms of outcomes, but I will put my brain, my pen, my recording at your advice. At your disposal as well. And I hope other council members on this committee will do the same. I really want this to make a difference. I can't stress that. We asked the senior officers a month and a half ago, what can we do in a short term that can be effective? And we were told one of the areas where we can be really effective is setting out a policy to tackle obesity. And that came from the top, and so the top's going to have to find the resource for it. And if it doesn't happen, they'll have me being the infamous Mr. Angry shouting and bawling in the council chamber again. So I'm giving my 100% backing to the people on this task force as chair of this committee, and knowing that, who would like to play a part in this task force, please? We've got Councillor Fish, Councillor Jones, Councillor Rigby, Councillor Panjala and Georgina Bonsu. Is there anybody else that comes in that would like to put their name in the hat? Are we happy with that as a group of people? Everybody happy? We need to nominate. Sorry, we need to nominate one person as chair. I think Councillor Rigby, you've got experience in the field. You've shown passion and care for this subject. I would be honoured if you would accept an invitation to chair this task group. Right. Okay, I'll now go to the formal part of the meeting. Hopefully you've taken notice of which members and our co-operative member will take part. So I'll read the recommendation. It will be slightly different to as it's down in here. It will be the People Overview and Scrutiny Committee has set up a task and finish group to agree a scoping document and to support the scoping document and the terms of reference. We have appointed a chair and we have nominated members who are going to sit on the group, who are, if I go through again, it's Councillor Panjala, Councillor Rigby, Councillor Jones, Georgina, and I may have missed Councillor Fish. Yeah. They're the members. So I'm assuming you can get that down in English rather than my ramblings. That is the recommendation. Do members support that? Thank you. And we move on to our next item, which is the report. It's a verbal report on the integrated medical and wellbeing centres in Thurrock, and there'll be a presentation, I believe, by Mike Thompson, who representing the Thurrock Alliance, and also with us are Ian Wake and Rita Thakaria, who may also be able to answer questions. Sorry.
With your permission, so what we thought we would do, if I just kick off and set the scene, because I'm conscious that there are some members here that are very expert and well versed in this, including portfolio holder and cabinet former portfolio holders, but maybe some that aren't so much. Then Rita was going to speak about what's happening in Corringham and then hand over to Mike. Is that okay, Chair?
That is superb. Wherever you lead, wherever you kick, I'm happy to follow. So over to you, Ian Wake.
Okay, so again, apologies for some members will be very well versed in this, but the concept of the IWC, I think, is twofold. Firstly, to provide collaborative space where a range of services can come together, so things like NHS community mental health services, primary care, adult social care, some hospital diagnostics and outpatients, public health and the third sector. And then secondly, to provide a collaborative space from what we call our integrated locality teams can operate. And these are critical, and they form a critical part of our integrated care strategy. And the concept of these is that many residents have overlapping needs. So, for example, housing, addiction issues, mental health, adult social care problems. And historically, the public sector has responded to these by delivering functional interventions from different teams in different places with different eligibility criteria across different organisations. And that makes it really hard for residents with that level of complexity to get the help they need. What tends to happen is they are bounced between different services and they bounce around the system and they don't get their needs met. So the concept of the integrated locality team, and we have 4 in Thurrock, around the 4 primary care networks, is to bring professionals from a range of different teams, adult social care, housing, NHS community and mental health, addictions, local area coordinators, colleagues in the third sector, together in one place to form relationships with each other. We talk about the power of informal relationships in our strategy, and with residents, and then to act in a really coordinated way to intervene at the earliest possible opportunity, to design with the resident a single solution that meets all their needs in one place at one time. And at the heart of that is something called relational practice, and that just simply means we aim to form a relationship with each and every resident we try and serve, to recognise that they are as an expert in their own lives as we may be experts in our professional field, and they have an equal amount to bring to the table, and that ensures that the solution, and it's a solution rather than delivering service functional interventions, is really bespoke and meets their needs. And it's a solution in the sense that it aims to play strengths and assets in the community into that solution, again, rather than just delivering clinical intervention. So the example I usually give is around mental health. If you feel depressed, rather than just going to GP and getting a prescription for an antidepressant or a referral to counselling, if you're working in a solutions-based way, you might think about what are the other things in the community that might help someone recover from their mental health, whether that be fishing or gardening or men in sheds projects. Yeah, and it'll be different for every person. So it's about trying to bring a much broader range of community assets into that solution. And one of our GPs recently said it's revolutionised how we can practice medicine in Corringham, because it's so much more holistic and so much more integrated. So to come back to the IMWCs, that shared space to deliver those integrated locality teams is absolutely key. As members probably all know, we've delivered one of the four in Corringham, but for a variety of reasons, the NHS has not been able to move forward on the other three for affordability issues. So business cases were submitted to NHS England and they deemed them to be unaffordable. There are a range of issues that underpin that. The NHS was restructured during the programme. That caused quite a lot of problems. The personnel changed. The organisational footprint changed from Thurrock CCG to one across Mid and South Essex that's obviously much bigger. The health of the organisation changed in terms of its finances. So Thurrock CCG was always actually within budget and had healthy finances. Mid and South Essex, as you're probably aware, has an enormous deficit. And some of the rules nationally from the NHS changed as well. So particularly the rules relating to capital. So in, I think it was 2021, NHS England imposed something called a CDEL capital limit on local systems that mean it gave a total amount they could spend on capital. And the leases on the IMWCs were put through this very complicated formula that converted it into a capital value, and the cost of the leases blew the system's capital limit. So I fully understand this is enormously disappointing to members, and you were given assurances by NHS colleagues, and those colleagues, well, those assurances have not come to pass. Those colleagues are no longer largely in the system. What I think we need to do is to find a plan B and to look forwards now rather than backwards. So I hope that as a session we can focus on the future rather than just rehearsing the past, which was discussed at length at the last session. And whilst we're not going to get all singing, all dancing buildings, the really important thing for me is in those other three localities that we find and identify and refurbish some shared space from which the integrated locality teams can operate, because that is the magic for me in the system. And what's really palpable, and we could talk more about this, is that in Corringham, where we have that shared space, that ILT, that integrated locality team, has been turbocharged. Where we haven't in the other three, it's harder to bring those professionals together on a regular basis to form those relationships with each other and with residents. So I'll stop there. I hope that was a helpful overview, and hand over to Rita, and you can talk a bit more about Corringham and the ILTs.
Okay, absolutely. So colleagues, the initial exam question I was given was to provide an overview of what the original plans for the Corringham Integrated Medical and Wellbeing centre were to be, and then any changes made along the way in terms of the actual room allocation and services being applied to the centre. And then secondly, to really think about and talk to what do we have now on that site, and are we fully utilising it? And as Ian has outlined, are we really getting the benefits of that integrated working? And have we delivered on the Better Care Together strategy, work plan year one? So again, I myself came back to Thurrock in 2022, and I was part of the original journey back in 2014. And when I arrived back, we actually opened the building officially in November 2022. Huge pride in actually coming back to the all singing, all dancing building that we wanted it to be, and really to allow for that integrated working and solutions, and actually reducing the number of handoffs, referrals and duplication within the system, and getting people that are working with our communities to build those relationships and start to build relationships between themselves and have the opportunities to have holistic conversations and work with individuals. So first and foremost, in terms of the original plans versus what has actually arrived onto the site, there's been a few changes, and I'm going to give you some very specifics just for this part of the conversation. So since opening, one of the staff meeting rooms, we've reallocated it to becoming a prayer and wellbeing room at the request of frontline teams. Secondly, one of the original office rooms, again, has now become a consultation room for both our social workers but also our sexual health team. The original plans were for a Mid and South Essex therapies team to run from that site, which would have come from the Mid and South Essex Foundation Trust. That's no longer in place. And secondly, there would have been an ultrasound facility from that site as well, which is not in the actual building as it stands in the current format. Those were the key changes. To where we are now, we have over 27 teams utilising the centre from at least 8 different providers, including mental health services, so NELFT, EPUT, community health services being NELFT, Mid and South Essex have their midwifery services, and some of the phlebotomy elements and some of the specialist services there. We obviously have our Thurrock Council teams based there, so our CLS teams are based from there, housing teams are based there, antisocial behaviour teams, etc., are all based from that site. We also have psychological services, Forward Trust and Mind. Daily activity at Corringham Integrated Medical Wellbeing Centre is being captured manually, and we have seen a steady rise, as you would expect, since opening. On average, there are over 559 people attending weekly for appointments at the centre. However, this does not include the number of residents attending group sessions and drop-ins and opportunities to engage, perhaps with a receptionist or other people they know are in the building and they can access now that they know we are there. There are a number of drop-ins and walk-in services, and actually listening to our residents and the communities, which many of you will be aware of, we've now got a walk-in phlebotomy service, and if you drive up to Corringham first thing in the morning, you will see that the queues start to form. You get a nice welcome from people as we start to walk in, and we have changed the environment so that it's much more about how the residents want to use our services. We have baby weighing clinics, we have well homes and family hubs from the site as well. We have seen an increase in the number of partners wanting to use the site. So it's both partners from across health and care, voluntary sector, but actually we also have partners wishing to collaborate as partners at both senior and more junior levels. And we have accommodated where we possibly can. I think it's a really good opportunity for us to showcase what is possible and the art of the possible of working differently with our community. So we are up for that where we can accommodate it. Overall daily usage, we are using the facilities up to 95% plus on a daily basis. We have the ability to flex as well in terms of usage of that space. Another concern that was raised, which is totally understandable, is that the building is open over significant hours during the day and at weekends as well. So we have evening sessions now. Sexual health services are run from the site, as is inclusion. At the weekends, we've always had the facility open to our community nurses, who'll be dropping in to see patients and will be coming back to the Corringham site to pick up equipment, have handovers, etc. But from August, we will have the virtual wards and other teams, sexual health teams, etc., also working on the weekend as well. There are a number of community groups using the site. I just wanted to give you an idea of some of the community groups that are using the site. And this is again through word of mouth. And again, members have also supported us with some of that word of mouth movement. So we currently have the Alzheimer's support group, the family hubs, the Artism, which is an art therapy for people with autism. Health Watch are visible and often present on the site, as is Voiceability, and who spend a lot of time there engaging with residents as well. So in terms of the collaborative space, so in addition to obviously the facilities downstairs, if you come into the centre from the beginning that you walk in, you will see that there is an indication that residents have been part of it. The building came up during COVID, so we couldn't do as much engagement onto site. However, we rapidly mobilised that position from as soon as COVID rules changes allowed. So when you walk in, you will see immediately that there are the handprints of children from the local school. And we have had grandparents, families coming back into the building to say, I came to have my blood test, but actually I forgot to check. My granddaughter said I needed to check her handprint on the glass. However, we don't put the children's names on there, so it's quite difficult to work out whose handprints they are, but they are there. The children were also involved in actually the tree planting and naming the community rooms. So we had a naming competition for them as well. As I said, we have had regular engagement with residents. We ask for feedback. We have done surveys with residents. 40% of our people that use the facility, so service users, are actually walking to the building and using local transport if absolutely necessary. We have had stories of residents that have been able to have their services moved from Thurrock Community Hospital to Corringham Integrated Medical and Wellbeing Centre, which has meant that they have had to they've been able to reduce their travel costs significantly and come in on their mobility scooters. So these are the stories that we really wanted to celebrate today. But also I wanted to then take you to the first floor, which is where you are welcome to come along. We have collaborative spaces. The design of the building hasn't changed dramatically in that respect from the very beginning, and the expectations of the Better Care Together strategy. So actually the space is, yes, whilst we have a hot desking facility, more importantly we have collaborative spaces. So wherever possible there are opportunities for people, professionals, multi-agencies to actually collaborate and have conversations. When we first opened the building, we had housing on one side, we had antisocial behaviour team on one side, we had the community nursing team on the other side, we had a number of the other health services like virtual ward, etc., sitting on the other side of the room. And that was great because at least they were sitting in the same building. Actually, what we've seen over time, and they're very comfortable with me taking pictures of them, seeing them move around the building, and actually now we see virtually that connection and that integrated working and solutions. We are seeing generally in terms of conversations that there's less escalations to senior management. They're finding solutions between themselves by having those good conversations. So that wraps up my update. If there are any questions, I'll take them now before we move to Mike.
If anybody want to ask any questions, particularly, and then we'll move on to Mike.
Thank you, Rita, for your presentation there. The IMC walk-in services, so at the moment you mentioned people going there for blood tests and things like that, but walk-in, what else have you got available there? If someone, has got an eye infection or something like that, is it open for that? I'm chairman of the local forum, which sits outside there. We have meetings there. We have had a lady come over to explain what was happening at the IMC, one of the things that has been brought up is that, you know, well, it's supposed to do this, it's supposed to do that, and it's supposed to do that. And as Ian said, you know, it hasn't sort of materialised in that fashion, a lot of the things that was promised. But what other walk-in services are you intending to provide? Thank you.
So blood tests are the key change we've made. The other sort of walk-in ability is for people knowing the services that are currently on site that they may want to come in and have a follow-up conversation about. In terms of where you talked about the eye infection or another minor illness type sort of conversation or need to be reviewed, that wouldn't be offered from the site. That would be for people to go to minor injuries unit, because we wouldn't have the skill set and facilities to support that sort of discussion and consultation. We do have access to primary care from the site. We did have obviously GPs from the site as well. We do have access to specific services from primary care on site, but it isn't actually a walk-in for minor illnesses or minor injuries.
I mean, the other thing what you just mentioned as GPs, that originally was going to be the idea. We've got so many GP, should we say, practices around Stamford and Corringham, which basically run out of houses. And the idea was that that building there was going to supply a good environment for these GPs to operate from. So, you know, where's this gone? I mean, I know they're still using houses, some of the GPs. Did they not put themselves forward as to use that facility, or have they been offered to use that facility? Thank you.
It may be a question for the ICB rather than you.
Yeah, so certainly in terms of the Stamford Lee Hope PCN, so our particular locality of GPs, they have used the site for specific pieces of work and were based there initially. And you're absolutely right and correct that originally there were plans for 2 GP surgeries to be based from the centre. However, that changed with time. When we opened the building, Stamford Lee Hope Primary Care, the PCN was actually on site. They have now moved across some of their services to where the primary care actual GP appointments are now based at Corringham, just down the road, the Corringham Health Centre. We still have the Healthier Futures Clinic running from that site, which obviously has GPs as part of that offer. In addition to that, over winter periods in the past, we've had the acute respiratory hub, which was run by primary care, and we're seeing up to 66 people per day for minor acute respiratory illnesses specifically. But the broader piece around the GPs and the GP fellows, that would be more of a question for the ICB at this point.
Thank you. If you want to move over to Mike in terms of that. If I just may ask, the fellows that you just referred to is the much lauded scheme, I believe, where we were going to bring in new trainee medics. They were going to spend part of their time doing research work and completing their studies, and so that's sort of not really happened then, is it?
So the expectation originally was 12 GP fellows. My understanding is we're at 3 GP fellows. I've actually connected with one particular GP fellow who is developing an interest in older people and frailty, which is a key area that we're keen to develop on. But the ICB would give more details on that.
I'm sure in due course we'll check on that. But it was a great idea, and I hope that 3 becomes 6, becomes 9, and who knows, one day 12. But over to Mike.
Thank you. So I'm just going to start, I'll come back to the GP fellows in a moment, if that's okay, and primary care. So building on what Ian had described in terms of that strategic overview and the aims around the integration and strategy, and what Rita's articulated about the successes of Corringham. So what we're doing in the next couple of months then in terms of the plan B, as Ian described it then. So we've created an estates group, a core membership of council officers and the Thurrock Alliance, so ICB, myself included. And what we're working on in the next 2 months then is to create options for those 3 other localities, building on the success of Corringham and looking at the original if you like, schedule of accommodation and intentions around the original IMWCs in those localities, and then looking at, if you like, the art of the possible around those options, what we can do with either underused or vacant facilities, space, sites that are around, making better use of some of the facilities and space that we've already got. We've already got some proposals going through for better use of Corringham Health Centre, which you just talked about, and also a couple of proposals around Stifford and South Ockendon that are going through the approvals process just in terms of the funding, to make better use of the space that they've got and the rooms that they've got and convert them into better multi-use facilities. So some of the work's already started is what I'm trying to convey there. And then in the next 2 months, and bringing options back, or completing some options by September in order to then represent to this committee and to others as necessary. And that those options, as Ian said, they're about securing those integrated working spaces, and identifying a series of options that could be workable. They would need to proceed into sort of business case and more detailed development, but they will be constructed with the partners, in particular using the providers, using NHS property services, using all the experts that we've got in terms of estates, facilities, and the providers of the services. So the aim is to bring you those options in a couple of months' time, and to identify them for each of the three locality areas. It will also build on the development of the ILTs themselves, the workforce, the types of roles that the PCNs and the ILTs are using. We've got 6 GP fellows, by the way, which is good. So we've got 6 in place now. I'm not quite sure when it went from 3 to 6. I think that's quite recent, but we've got the 6, which again, I know there was an ambition for 12 at some point, but 6 was still above the national sort of scheme, and we actually bought more than we ordinarily would have gone around in terms of the deployment of GP fellows across places. So I think that's quite a good position to be in. And then there are other roles that we will pull into the ILTs as well. So when we come back, I think these are not just options around the estate and the potential around facilities and sites, but also around that wider model and how things could operate within those facilities. So building on Corringham, building on the intentions around IMWCs, and giving, if you like, a plan B that will not say wholly reflect what was meant to be in terms of the buildings of the IMWCs, but in terms of those benefits, and give those equivalent benefits as that plan B when you line them up against these other additions and other enhancements. And then separate to that, but I just draw your attention, obviously we've got the Clinical Diagnostic Centre that's going up for Thurrock. That's making progress. It had initial, I think, stumbling in terms of the groundworks back in January, but the frame's going up in 2 weeks' time, the frame for the building, and it's due to open in July next year. So the Clinical Diagnostic Centre, as one of those physical assets and service delivery units, is also being played in alongside these potential options for estates utilisation. So I'll pause there. That's sort of a discrete piece, but I think it builds on what's just been described by Ian and Rita, and you'll see the options. And so there's definitely I'm also here to listen. So I know there's lots that people will want to feed in. I know lots has been discussed over periods of time around bits of the patch, and I know that, for example, and speaking to a council colleague today, that the Tilbury in having a focus because of its historical, if you like, gaps in provision and gaps in suitable, appropriate service. So all of that can be played into the options. So I'm saying that, I welcome thoughts, things to take away, things to consider that we can feed into this piece of work and get it going at pace in the next couple of months to deliver some options.
I'm sure there'll be questions and thoughts and suggestions, but first to speak, Councillor Arnold.
Thank you, Chair. I kind of might go on a little bit because I am absolutely passionate about IMWCs and the Corringham one. And Councillor Jones, I know there's a lot of historical stuff that didn't happen, but if you haven't been recently and haven't had the real tour and looked at how it's working, I would urge you to do that, because I think what you have proved is the building wasn't actually built for an IMC. You inherited a building, and Rita and everybody else has made that building work. So I feel encouraged about a plan B, because for me, it's you obviously need a building to be able to make it work. But what really makes the IMC work, and that is its heart, and that's all the people that are in it. It's the transformation that they've been able to do with how they work, and the fellowship GPs. I know that's been a sheer hard slog from everybody. Task force was set up, encouragement through brochures about where you could live, what kind of diversity there is in the borough to deal with medically. They've tried everything. So I'm encouraged that we've got to 6. 12 would be fantastic, we'll see. Have you yet managed to get a declaration from Rita that she is never going to leave and that she will be here for this whole process? Because she really does make that organic, holistic approach work. I came to the IMC discussing a fractured group of looking after dementia family, that they wanted to set up their own group. And Rita absolutely ran with it. Well, it's not just that we can look after dementia, we have nutritionists here, and as the disease progresses, they need to have their nutrition checked, the mental health, the support for the people that are caring for those. And she instantly put the package together around that. So I would say give this a chance and actually go back and really have a proper look at what's in the IMC. I feel blessed that I live in the catchment area that can use that. And if I phone my GP and I can't get an appointment with my GP, I've had appointments within the other health centre, within the IMC. So for me, it is doing what Ian and Rita and Adult Social Care set out for it to do. My question at the end of it is really, who's going to be heading Plan B, operationally getting it off the ground? Because I don't want to sound derogatory about the NHS, because we wouldn't be here without them, but historically we've lost that flow because all of those people have left. Every barrier, every stumbling block was over conversations and moving forward with NHS England and all of that. It wrapped us up in so many barriers and red tape that we need to take that flow and organic working that has been learnt in those processes historically from the Corringham IMC and use that to go forward with the others, not tie up with somebody from the outside that's going to come in completely different and doesn't have an understanding of what's really been built. And it's vital that those relationships between those partnerships have time to build. And it's been really sort of quite interesting to hear what you've got and what you've done and how people have moved around that room now. So it takes time. It does take time, but it's in a much different place to when you first started with it. So please, Councillor Jones, go and see Rita and have a visit.
I'm not sure how to follow that. Just in terms of the options, and I must come and I've not been to Corringham myself. Just in terms of the options, I absolutely agree. When we get to a set of options and whether we have to prioritise them or whatever, well, we get some options in the autumn. I think who leads the next development of those options is precisely as you describe it. It's the best person or body to take forward with the passion, the drive, and the commitment to doing so. Other people, because we're working as partnership across sectors, can do the red tape and the bureaucracy bit if that's around NHS property or NHS England or whatever. And I've worked for the NHS, so we recognise there are steps around those processes, but they shouldn't hinder the development of whatever the best options are. And I think if that's NELF to lead something because they are the best people and the best body to do so, then I think that's what we should consider when we've got some options to talk about. Or the council, for that matter, as they would be equally capable.
Just to give you a bit of assurance and comfort, because I think it's a very fair challenge, it's the estates review is being led jointly between adult social care and the ICB Thurrock Alliance element. So that's the Estates Review Board. That will report in October. The funding for refurbishment is likely to come from the Better Care Fund, and there is a lump of capital in that. So there is a huge amount more local control than there was. There won't need to be any kind of major business cases to other supra NHS bodies. So I'm a lot more confident over the IMWCs that we'll get the result rapidly that we need. But as Mark has alluded to, who leads the individual refurbishment of the individual building would depend on who owns it, I think.
Sorry, just come back on that. In my time in meetings in the Integrated Care Partnership, this is maybe explains where I'm coming from. I mean, Ian gave me this grave upside-down pyramid of how our budget is spent on health, and so how vital it is for preventative care and primary care. And that's what local authorities, I feel, are better at than the NHS, because they're at the front face of that. The NHS are incredibly busy keeping us alive in the emergency situation. And in the room, it was like the NHS are facing this way because they've got all of this to fight, and absolutely they need to be focused on it. So they can't give the focus over here, but we need that focus. Otherwise, our budget's going nowhere.
Thank you. Just one point. Acronyms sometimes get in the way, and this is for anybody who is out there in the great wide world watching. We've made reference to the ICB, and we probably, because we know what those initials stand for, Integrated Care Board, it is the new level of administration for anybody that wants to know, that has come in to replace what was the CCG previously, I believe, and before that the primary care, whatever. I mean, the ever-changing landscape of the NHS baffles me. And if we talk about the money over the years that have been spent on restructuring, we'd probably all gasp. But I would say sometimes if we all think, and I'm as guilty as anybody else, we should, when we're using an acronym, maybe just take a pause to explain exactly what it is. Anyway, moving on.
My apologies, Chair.
No, not at all, Ian. Not at all.
These are programmed into my brain, I'm afraid.
Councillor Mann. Sorry, Councillor Mann. Councillor, I'll come to you next. Councillor Manwell's got
It's just a quick question. In terms of the other locations that have been scrapped for the IMWCs, are there any concrete plans for what's going to be done in terms of any sort of timeline or scale? Because I hear Councillor Arnold talking about how well the Corringham one has worked, and I really think that it would benefit those other locations, because it's really unfortunate that they can't go ahead as they were originally planned. But as has been said, we can't focus on the past, we have to look to the future. But I'd be really interested, I think a lot of residents would be interested to know, are there any concrete plans in terms of finding an alternative provision for the other locations? And I know you've said something about refurbishments in terms of not necessarily building something new, but using existing buildings and operating from there. So is that going to prove to be a difficulty in certain areas than others? And is that going to potentially be a barrier to some opening if they just can't find a space that will really work for what's going on? Because I think that would be unfortunate, but it'd be good to know what's going on with that.
So in terms of the locations, it's so the three locations of the original IMWCs that haven't happened were one in Purfleet as part of the PCRL development. The Grays one was at Thurrock Hospital on Long Lane, and PCRL. I beg your pardon.
What is PCRL?
Oh, Purfleet Care Regeneration. I don't know. I can't remember. It was the Development Corporation that was going to develop Purfleet, and the Tilbury one was a parcel of land that was owned by the council. Obviously, the Thurrock Long Lane site is still as it is, and there's plans for the Community Diagnostic Centre, the CDC, there. In terms of Tilbury, that's a decision ultimately for the council in terms of what it wants to do with that parcel of land, and I know there are discussions that will come back to members to make that final decision. On the Purfleet site, it looks like that whole development is now not happening, so we would need to identify another location. In terms of your questions on alternative locations, I think we're pretty confident in terms of the west of the borough, so around Purfleet there's a couple of options, and there are multiple options in Grays and Tilbury. I think that's potentially more challenging at the moment, but we are still looking. But I'm relatively confident we will be able to find alternative space that we can refurbish, yes.
Thank you. I mean, I share your kind of concern or hope that like they can find alternative space, because it would really benefit people, and it would be quite unfortunate if that's the reason why nothing can really be provided for the area. It's a long time coming, but anyway, thank you.
Councillor Cecil.
Some clarification again. So how much of the NHS, how much does the NHS provide in Corringham IWM? Or is it all done by other partners?
So the question is in terms of the utilisation, so in terms of clinical services, or in terms of... Is it an
NHS facility or is it not?
So it's a NELFT building. So the building is owned by North East London Foundation Trust, which is a community health provider. But it's actually allowing for partners to use that space so that we can work in a collaborative way. And this goes back to the original principles of the Better Care Together strategy, about actually each provider having the ability to provide us with facilities and then to have that mutual working across different buildings so that we can work in an integrated way. Don't know if that's answering your question, Councillor Cecil.
I think you are. What about the district nurses, or are they not district nurses?
Absolutely. So we have so the way our district nurses, community nurses work, they actually are. So we have split our community nurses to work in each of the 4 PCNs. So they work close to their GPs and other partners, so they can really work closely to finding solutions for residents and get to know each other better. So the particular district nurses that are based there will come in first thing in the morning. They'll do their handovers, they'll come back at lunchtime, they'll do their handovers, they'll meet with people and they'll go back out, because most of the time they're spent visiting patients in their own homes.
From the NHS, or are they employed by somebody else, or are they self-employed?
So the district nurses are employed by North East London Foundation Trust, an NHS provider.
Thank you very much.
You may, Councillor Cecil, as long as you're on the button.
It was directed to the gentleman. You talked about gaps, and we see gaps all over the place, and one that's especially apparent today is NHS dentist. Is there any chance that you'll get an NHS dentist in there?
That's not currently in the scope of what we're looking at, but I know that my colleagues in the ICB are looking at the scope of dentistry. I know it's a challenge, it's a challenge nationally, isn't it? So if it was, possible as part of an option, then that could be, yes, but I don't think it's in scope at the moment. I'd say that's probably unrealistic at the moment, just from the nature of the provision that we've got. That's not to say it couldn't be possible, but I would say it's not in scope at the moment.
We do see that there is a real need for NHS dentistry in the east of the borough, but we can't.
Well, I think the need for the dentistry is, the building is not the issue in terms of the need for the dentistry at the moment. So my commissioning colleagues for dentistry need to look at the provision of dentistry, and then the locality or the buildings or where they operate from is a secondary to needing more dentists and more, if you like, more dental practices or more dentists within dental practices. So that's a separate programme of work within the ICB that's not, I mean, it's tangentially linked in terms of if there was a new building or an opportunity within a building, then potentially, but I don't think that is really going to be realistic in the options that we consider in the short term, maybe in the longer term.
Thank you, Councillor Sess. I think it's not down in writing, but we certainly had spoken informally about looking somewhat closer at dentistry in the not too distant future, because we know it's an ongoing topic of concern. At this point, I'd like to invite Councillor Hooper, who would like to speak on this subject.
Thank you, Chair. I think the IMWC in Corringham is absolutely amazing. And it'd be great to have 3 others, but we can't. And we have to think about the future. So I welcome looking at another plan and looking at other sites. There won't be IMWCs as the same as Corringham, though. There'll be valuable, certainly, meeting places for different professionals to work collaboratively together, but it won't be that lovely building we've got in Corringham. But the original plan, we were going to move services from the Orsett Hospital site into the IMWCs. Well, clearly that can't happen. That hasn't happened. So until there's a better offer, I really want some assurances that the Orsett Hospital site is safe and that the services will remain there until we have that option. And I really want to make it very clear that I do not accept that the diagnostic centre, which I really welcome, I think we all welcome in Thurrock, isn't replacing the services at Orsett Hospital. They were always designed as separate services on top of what we were already going to have in Thurrock. Can you give us an update in terms of the hospital, in terms of that particular plan? Because I'm really quite concerned about the building of the hospital. In terms of, I think in January, February, there were concerns about the fact that there was about £12 million worth of urgent repairs were needed on that site. So I'm concerned that it's actually going to be a working building. I know we call it a hospital, it's not really a hospital, but it's a site. So I'm really looking for some reassurance on that. My predecessor, Councillor Cockshaw, and I did write a joint letter to the department, which we never got a recognition letter of reply in terms of our concerns around the repairs in our hospitals, both at Orsett and in Basildon. And that's something that I will be following up very shortly, but I want to talk to a few more people before I do that. So I don't know if you want to come back to us on that.
I can come back on the main point, certainly, which is there are no plans to remove or to close Orsett or remove services from Orsett until there are suitable alternatives in place in the community. And I did check in with the trust this week to ensure that was still the aim around Orsett. So that nothing's changed. That is the commitment that it will not take services out until the alternatives are identified appropriately in the community. I think the challenge around their backlog maintenance, which you talk about in the capital, is an ongoing challenge for them, and they are they manage that on a risk assessment basis, on a weekly, monthly, relatively short-term basis. And I think, having come from a secondment within the trust for a year, they do that well within the constraints that they've got. However, they recognise that parts of the fabric of some of the buildings in the estate, is far from ideal. It is managed from a safety point of view. In terms of taking that forward, though, I do know only from the last day or so that a meeting's been arranged with councillors on the request of councillors via the trust, specifically around Orsett. I was asked for my availability yesterday, and I'm sure that must be going around whichever relevant councillors it is. on the, being organised by the trust to specifically pick up some of these issues in more detail in a separate meeting. So hopefully that will give some of that further assurance on those secondary matters. But the first point, as I said, no plans. Does that help? And I take your point that the CDC was not designed to accept that as well.
My understanding was that some of the services were being moved from Orsett to the diagnostic centre. That was a concern I had, but that's something I will double check. I am concerned about the Orsett Hospital site because it could be used that the building isn't safe for the services that aren't there and could give it a reason to be closed. I'm quite happy if there are alternative services for Thurrock, but at the moment there's nothing on the plan. So I haven't been contacted about that meeting, though I did ask for that meeting. So I look forward to that. But I really would push getting this second plan up and running as quickly as possible. We've known since January, February that these centres weren't going to open. So I'd really like to push this on as much as we can because I think we're waiting too long.
If I could just, so I think they will be in touch with you very shortly about that meeting. I think they were canvassing availability of people from the trust and the ICB in the first instance to give you some firm dates. And I take your point. So whilst there may be some services that are currently delivered in Orsett that might be provided in the CDCS, with the point being that it wasn't designed to specifically do that, but in the development of the CDC and in as time moves on with Orsett, there is the opportunity to put those services into CDC. But that was, if you like, not an original design intent, but part of the development of the CDC. But again, that is still going through the modelling, the development of what services and the capacity, and is an ongoing development. And I'm sure the trust can provide you with a great deal more detail, as indeed could we, on that outside of this meeting.
Thank you. I'm conscious time is pressing. I want to try and get to the end without standing orders, but Councillor Arnold, the floor is yours.
Thank you, Chair. It's just kind of backing up Councillor Hooper and Councillor Cockshall, because I was the Cabinet Member for Adult Social Care before Councillor Cockshall, so we're talking a few years now. When it was emanated to Ian and I that the IMCs weren't going to happen, one thing I discussed with Ian and with the team that are no longer available within the NHS is that we be supplied with a list of all the services that are and have been available at Orsett, and the data was being looked at as to where across the borough those services would be best placed, because it's no good putting the diabetic clinic in Corringham if the majority of people that need to access diabetic clinics are in Tilbury or Purfleet. So that work was being done. And so that we would know where the services from Orsett would be going across the borough. I was told that I would get that in the summer as Councillor Cockshall took over, and here we are with Councillor Hooper writing with Councillor Cockshall, still asking for that. But it was being worked on, it was being done. So this is why I worry about who heads it and how we get that continuity of what we've been trying to process before I go completely grey.
I'll happily take that away to look at. Was it the trust or the ICB who was providing that particular piece of information? Just that will help me go in the right direction, if you know what I mean.
I don't know which part she works in, but if I say Tiffany Hemmings, then
ICB.
ICB.
Okay,
then,
thank you.
So you know where to go.
Councillor Arnold, done. Thank you, Mike. I've just got one thing there. As a wordsmith, you're probably not surprised I picked up on something, and I'm always aware of spokespeople for public services being very careful with the words that they used. And I'm sure it wasn't meant, but you did say when you were talking about services moving away from Orsett Hospital, that would not happen until new sites were identified. I think I could speak on behalf of colleagues that identified is not acceptable delivered is the word that we would want to see.
The note I wrote for myself said, and this was following a conversation, until suitable.
Absolutely fine. This is also hospital. These services have been a pain in the lives of an awful lot of people for a lot of time. But thank you for coming into the Lion's Den, and I look forward to hearing from you again. So we've got a few minutes left. The only item left, because there's no recommendation on the discussion that we've just had, it was all for noting and discussion, a verbal report, which we're very grateful, as I say, to Ian, to Rita and to Mike for, and for the summary from the portfolio holder as well. So we move to the final item on the agenda, which is the work programme, and I think we should concentrate on the work programme relating to the meeting in September, which is early in September. I think we're going to have an ever-changing feast and of things that we want to talk about, depending on how things happen outside of this council, this authority, and the various levels within the health services. We have and the next agenda item again is from Ian, which is the Better Care Together Thurrock delivery plan, and I'm sure we can take that as a starting point. In terms of what we've discussed tonight, there's nothing other specifically on for that meeting. I would suggest, and it will only be, I imagine, a brief report, but I would like, if at all possible, for Councillor Rigby, as chair of the Task and Finish group, to update us at that point on negotiations that have gone on, arrangements that have been made. You probably won't have even met by that time, but you will certainly, I'm sure, have spent a lot of time working on it, and colleagues who are on that task force. So it would be useful to be updated, and if in the interim you need any help or whatever, we'll bring it back to that meeting. So if members are agreed on that one, and I would like to get an update at that meeting on the subject that I raised under urgent business, which was based around the Mid and South Essex NHS Trust and the waiting times for appointments for children. I would definitely like an update from that, hopefully in person from a representative of the Trust. I would make it known I think they should attend, or a representative should attend every one of our meetings. They've got enough managers over there to get somebody to pop over to Thurrock. And I would like to suggest that we get a report from Councillor Hooper on the Cabinet's position on the subject matter we've just been discussing, which is the ongoing state of the IMCs, the state of the sites, and in particular, possibly whether there are any thoughts from Cabinet on a disposal of any assets that we have, and I'm thinking Tilbury site, and what's more relevant to that would be the disposal of funds. Could it be used to support things that are relevant to this committee? So an update from Councillor Hooper would be welcome. Anybody got anything else they think we should bring forward to September? Councillor Arnold, looks like she has.
Sorry, it doesn't have to be September, but when you put that on, it's just when I was looking at the work programme, I kind of noticed that we haven't got anything around budget and finance and how that's affecting people. So when we looked at setting the budget and there was those 54 projects, some of them do affect people in the call centre and anything around adult social care transformation programme. So it would be nice to know whether those projects that sit inside that are on target, performing, problems, issues.
I very much agree, and that's part of the reason why I'm very cordially inviting Councillor Hooper to our next meeting, and I think Cabinet members or portfolio holders should come and report, and they can give us a report on those issues and answer questions from members about particular subject matters. I mean, our job as this committee is to hold the administration and the other health services to account, and that's what I believe we will do. And if we've got some tough questions for those currently in charge, then let them be asked at this meeting. So I regard our work programme as a state of flux, taking on board the well-made point from Councillor Cecil, dentistry does need to go on there at some point because we have some questions. But there's not an awful lot, let's be realistic, not a huge amount's going to, apart from Councillor Rigby, who's going to be incredibly busy through August. There isn't going to be a huge amount of things that change, as we sort of have a fallow month, having had all the election fallow months, unfortunately. It's been a poor year for getting things done. But I would expect at this meeting we get a representative from Cabinet to speak on those issues that you've just spoken about, if that's acceptable, to leave it as a state of flux, but knowing that is the expectation of Cabinet for this meeting. Councillor Rigby, yeah.
Yes, I don't know if it's for the Director of Public Health, this question, but I'm sort of thinking maybe it might be worthwhile getting involved with local GP practices or the IMWCs with regard to the task and finish. Have you had any thoughts on whether that's within the scope of the working group?
For the childhood obesity task group, potentially, there haven't been any conversations yet with GP practices or primary care, but one of the suggested activities is a workshop with various partners who are working with families who might have overweight children. So we can certainly talk to the primary care networks to see whether they would be able to field someone to come to that, or whether there's an existing clinical forum that members might be able to attend. So I don't know the answer right now, but happy to go away and have a think about how we might be able to do that.
Yes, I think that would be useful, and also I know it would only be anonymous data, but also getting, I don't know how easy it would be to get, but getting data on each primary care as to their levels of childhood obesity they have within their surgery as well. That might be quite interesting.
They won't have that data, they don't collect it. So what you would be able to glean from GP practices are their insights into some of the problems that families experience. They may well be able to share case study examples. But GP practices wouldn't collect and be able to retrieve data on childhood obesity because their systems wouldn't collect it.
That seems quite strange to me, but maybe that's something they need to look at as well, I think. But thank you.
It'll be an individual patient records.
Yes, so it's getting them.
It's
out.
not anything that is systematically inputted into a database so that it can be retrieved. But what I would suggest is that we have an early meeting with you to clarify some of the things that we've included in the scope, some of the activities that we've suggested, so we can explore those in more detail and start to think about how we plan some of that as well.
I'll liaise with you sort of in August to set up an early meeting then. Thank you.
Thank you for that. Has anybody, we are literally down to the last couple of minutes. Everybody okay? Right. I will, at that point in time, thank particularly members for attending. Always great to see, and I think you've contributed to what has been a very constructive meeting. I leave here. I came into this meeting worried about the task and finish group. I've now just seen with my own eyes that it's in very good hands, and I look forward to seeing the work that it's done, and in particular the leadership on it of Councillor Rigby. I thank my colleagues to my right who keep me in order, and particularly Claire there, but also Carly for getting everything ready. The senior officers for attending in their evenings at the end of a very long day. That's Mike, Sheila, Sharon, Rita and Ian, and also to our co-opted member, again somebody who gives up their time for the community good. Absolutely outstanding. I've enjoyed this meeting thoroughly. I hope we have as many good meetings as this, and hopefully we try and achieve the things that we've set out on this evening. So at that point in time, at 9:28, amazingly bang on time, I'll call the meeting to a halt.